So I'm Dr. Alounoud Mohamed Almarzooqi. I'm from United Arab Emirates. I'm a member in the Governance Council of the World Federation for Public Health on the Middle East region. I'm so glad to be here, part of the World Federation for Public Health Congress, and I'm representing the Emirates Public Health Association in the United Arab Emirates. I'm working now as an assistant professor at University of Sharjah in the Healthcare Management Program at the College of Health Sciences. The World Federation Congress, in one word, it means a structured collaboration between different nations, between different generations, specifically connecting the more experienced public health professionals with the young generation. So change, it's a big word, but for me, I feel like incorporating digitization in healthcare in general and digitization and artificial intelligence in public health is the key cornerstone for any change in life, in policies, in interventions, and in collaboration. So I believe that one word or one thing that I would like to see on the ground after leaving that conference is to structure the digitization process, specifically in the era of artificial intelligence in public health. Sometimes language might be a barrier, but when the world has been put on a crisis like COVID, we've proved that we have the ability to cross those boundaries and to collaborate. So I feel that the language might be somehow a barrier, but it's not the main issue. But I would like to see, for example, more collaboration from the digital aspect of healthcare into two more languages like Arabic and French. As we are having our conference in Africa, I think maybe French will be one of the priority that we need to collaborate, and we need to enforce the sharing of those information in these two languages, Arabic and French. So for example, in the Gulf region or in the Middle East, we have like some of the pilot projects for the digitization and the implementation or talking about the artificial intelligence. So I think the conference will give the chances to talk about or to share knowledge about similar startup business, specifically among the youth, on how the digitization or the healthcare application can narrow the gaps and can help exchange information by meeting the people who are in the industry with the people who are expert in academia and in research. So collaborating between the academia and the need of the community, whether it's in Africa or outside the world. Cape Town and Africa is very rich in art. So the things that I can see that there is an opportunity to blend those artistic views and culture within the scientific evidences of the public health and the information that we are going to share and to learn in the conferences. So I think this is the one thing that I've noticed in person, and I would like to bring it up, to merge between the artistic culture, which is very rich in South Africa, with the science and evidence-based practices to reach the community more easier and to penetrate those communities with recent advances in public health intervention at all level, primary, secondary, and tertiary. We would like really to think outside the box. We need to think about how to bring the social media influencer. Like, for example, that question led me to think about who is really leading the social media platforms in South Africa, and to if there is an opportunity to reach those people, to engage them in those discussions, even if they are without any background in public health or they are not expert. The thing is, we always say, we need to link or we need to close the gaps, but sometimes we can't close the gaps alone. If we are inviting only expert and people who are keen and know about the scientific methods for intervention and policymaker, but we need to have more diverse group. And I think if we invited some of the influencer, specifically from South Africa, to be part of those discussions and to explain for them what are the issues we need to bring up, what are the solutions, because to tell you the truth, they might have like a number of followers more than me and more than an expert person in public health issues, and they might communicate in like in a way that can convince people about some thoughts or convince even a policymaker about the intervention required for public health issues. Like I was discussing with colleagues about like the search engines for articles and for research papers. So most of those search engine like used for systematic review or scoping review, like Covidence and others, they were like based on English, and they can like search for other articles. But I feel like the language barrier sometimes in research for academician, it might have an issue. So maybe this conference might bridge the gap between people who are programmers, who are designing those platforms, and we can like have something or in a sort of workshop or like a working group who will not like initiate or write policies, but they will execute solutions. And I think the best way is to run those workshops during the conferences or hackathons, maybe a practical one that will give birth to like a point of concept, a proof of concept or demonstration of those solutions that will enhance researcher around the globe, starting from Africa to the world, in order to build those platform in the languages that have limited access to recent-based research, like French and Arabic. So I think we need to look at very practical solutions at the ground. Like those solutions, and it mostly will tackle the healthcare applications, digitization, or platforms used by researchers or academicians to look for those articles.